So the topic this week is the coronavirus and concerted efforts to stop its spread. Governor Gavin Newsom this week announced a state of emergency for California after the first person in California died. He was on a cruise ship and returned home to Placer County and died. So Sue and Elena, you've done quite a bit of reporting this week on local efforts and reactions to the coronavirus. So we'll kind of start with just the numbers and then kind of work through some of the questions that the public has about coronavirus. Sue, there was an announcement yesterday of 20 cases in this county,
yes.
And that's 1/4 of the cases in the entire state. So we're kind of a little bit of a hot spot, aren't we?
I would say so.
Yeah.
Yeah, and so the one thing to keep in mind that was being stressed by health officials is that the majority of these cases are mild or people who have no symptoms.
Okay.
And so either you would find that they have no symptoms because they were being tested because of their proximity to someone who did test positive or had come down with
people in the same
symptoms.
household is generally what they're talking
household
about?
Household or caregiver, something like that. Maybe, I don't know, a hospital worker or something like that. Whoever it is that had been in touch with them, those, or might be their children, those are the people they checked.
Okay.
So thus far, as of yesterday, I believe there were 6 new cases.
Okay.
And 4 of those were found to not have any source that they could find how it had been transmitted. So essentially, it is moving through the community now, and they want people to be aware of that. And they've stepped up their efforts to roll out some ideas for how you can control that, like not being in large crowds, that type of thing.
Quite a few cases since last Friday. So what a difference a week makes. We had 2
Yes.
as of last Friday, the 28th of February, and now we're up to 20. And there's been a number of press conferences kind of rolling out. So there's that main difference now that the people with coronavirus aren't the ones who traveled, or they're not necessarily the ones who live with someone who traveled.
Right. Yeah.
Abroad.
They don't have any idea of how they got the disease.
Okay.
Has the county said how that's changing their approach in terms of containment versus treatment or that kind of thing?
Yeah, I think that they sort of feel that they're stepping up the efforts. It's not even anymore that they think they can so-called contain it, but they think they can slow the process down of spread through the community. And so one of the things they did was they really emphasized for businesses, start getting your people to telecommute and work from home from their computers. Don't have large gatherings. Really make sure that in a workspace you have people at least 3 feet apart from each other. So you're not all
proper distance.
Yeah. They're not all packed in together.
Yeah.
And this more or less, they wanted to see flexibility. They were hoping that workplaces, that employers will, especially when people don't have any. When they're not being paid, they get no paid leave. They want to see if you're urging them to please make sure that your employees get paid leave so that they don't have this, they don't say, well, I have to go to work, so sick or not, I'm going to go and spread the disease.
Yeah. So the symptoms of this disease include fever, cough. It's a respiratory illness, is it not? So people are watching out for these signs primarily?
Yeah, for the most part. I mean, it's kind of interesting when you look at the CDC site, they say cough, fever, and shortness of breath. Those are the 3 things. Those are the hallmarks of the disease. However, it can present with a sore throat, headache, many of these aches, body aches, a lot of the things that you see with the flu or the common cold. You can also see in mild cases of coronavirus, it's not as prevalent, but it's there. So, any of us, like this week I came down with something, I'm like, but it never did blossom into anything big.
Yeah.
And I never had a fever. I think if you went to the doctor, if you called the doctor and said, that's the thing, they also don't want you just to run into the doctor's office and spread the disease.
Right.
So, if you call, they're probably going to tell you probably have a minor cold or something else, or the flu, and there's a lot of flu going around.
Yeah.
So mainly what they're looking for are the serious symptoms. That's what they want to really zero in on.
I'm glad you brought up flu because I've heard that the COVID-19 is no more severe than a flu, and I'm just wondering if there's been any refinement on that. off-the-cuff assessment that fewer
Yeah.
people are dying.
Yeah. Yeah, I wish I was a little better prepared to give you information
Yeah.
on that because they did show some slides on that after one of the press conferences or during one of the conferences. And one of the things, or I think you'll actually find it on the county's website
Sounds
on
good.
the public health. But it really showed that they marked everything like measles was really, really contagious. You can get it really badly. It's
Yeah.
considered much more dangerous than COVID-19, for example. It's
Okay.
like, on a scale of 1 to 10, COVID-19 is like a 3 compared to measles being a 10.
Wow.
So, and flu is, it's a little bit to the,
Depends on which strain.
yeah, it
which
depends
year.
on what strain you get. It's, the one thing about COVID-19 is that it is so contagious. And that's the thing that really scares people is that they look at it and, the medical professionals are saying, it's just that it's very, very easy to catch. It's very
Okay.
transmissible.
Okay. So you've covered youth and education, of course, and the susceptibility of kids, higher or lower than adults?
They're actually low risk. The county has said that, and this is part of why the county is not recommending school closures at this time, that children are low risk unless they have some sort of underlying, health issue, the same as older people. But that it's better to sort of maintain normalcy for kids at this time and keep schools open if possible. Several Bay Area schools have closed, though, including Menlo School in Atherton, one in San Francisco, I think in San Jose and Oakland as well. Palo Alto has no plans to close at this time, and they've been pretty firm on saying that. We don't know. Obviously, things are changing literally
Yeah.
by the hour,
Yeah.
so we'll see what happens. But that's the county's advice at this point, that you shouldn't be closing schools.
Yeah, I found it interesting that Castellea is taking a day
Yeah.
so that they can prepare for online learning if that's necessary to close the school and send the kids home.
And it does sound like most schools are looking at online learning options just to be prepared, including Stanford and Foothill College, or just figuring out what they will have to do if that sort of comes to pass.
Yeah. What other restrictions are the schools and universities putting on personnel or travel or students?
I think the most striking have been at Stanford, and it's also sort of ratcheted up throughout the week. They've put out communications almost every day, I think, sort of changing their approach. They're now restricting university-sponsored travel to any country, which earlier in the week
really?
was just to specific countries.
Yeah. So it's not the level 3 anymore?
It's any country. They're recommending against international travel. They are limiting attendance at sports events to 1/3 of the venue capacity. There are a lot of events that were canceled at campus. But classes are still proceeding as normal, although I think some students, there's a petition going around that's asking for sort of a stronger response and preparing, for more online learning and what to do about finals and excusing attendance if students don't feel comfortable going to large classes. Because there was also some guidance Stanford put out about events with more than 150 people, and there's some classes that have more than 150 people. So I heard from one student who's sort of wondering, well, what does that mean for my large classes?
Yeah, yeah. Well, there was the State of the City address in Palo Alto this week, and I know people were talking about where does this 150 come from? Like, is it scientifically derived, or is it because of the contagiousness? Are they just figuring that the chances of having one person with, coronavirus within a certain number of people sets that threshold, or what? So it's interesting to see how people go about the strategy of containment and quarantine and stopping the spread. So there's been other organizations that have reacted. Some arts and theater groups, like on Stanford campus. The music department, I know, has canceled all of its events through April 15th. And I believe there's some
Downtown
lectures.
Stanford Theater has also,
Yes.
which is not affiliated with the university.
True, yeah.
They have also temporarily closed.
Yeah, out of an abundance of caution,
Right.
as they said.
Right.
And I think other groups, Theater Works is not canceling any performances, but they sent out a message saying that they're taking cleaning precautions, they're making sure hygiene protocols are well announced to people, audience members and such, and plenty of soap and hand sanitizer available. But tickets are also flexible and can be exchanged if people don't feel comfortable coming in. So it's interesting how many organizations are trying to figure out how to operate without completely shutting things down.
Right. One thing that came out of yesterday's press conference with the county is that someone asked the question about what about when you talk about large gatherings that people should avoid, what about San Jose International Airport? And so the county said, no, we're not recommending that people don't show up at the airport.
Yeah.
And so I don't know why it could be, those TSA lines can be pretty bad.
Yeah.
But you can be packed in together. But I do know the airlines are they're really kind of freaking out at the moment. And, we recently got a notice from one of the airlines telling us essentially, if you booked by, I think it was after February 28th or something like that, you can change your ticket, if you want to. But those of us who booked before then are kind of out of luck, So it's like they don't want to give everybody that much wiggle room. But they do recognize that people are concerned.
Well, I was on a flight last weekend, and the person who came in and sat next to me already, she had her handy wipes right before she sat down. It was like wiping off the armrest, and I thought, well, I'm not going to get it from her. That's for sure. She's very careful.
Did it make you feel better?
I did. It did actually. I was trying to not look like someone who might be sick because I don't want to panic anybody, which I wasn't, and I'm not.
You sneeze and everybody runs off the plane.
That brings up another issue I just want to mention. The sort of xenophobia, the fears around it, particularly linked to Asian people. And that's something that both Stanford and Foothill have mentioned. They put out sort of Q&As or just statements around it. Foothill sent out a message yesterday with a bunch of questions they've received from students and answers. And one of them was, I saw a group of students not wanting to sit next to an Asian student in the cafeteria because they were worried they would get sick. And so I think administrators and officials of all kinds are trying to sort of clamp down on that, but that is absolutely happening. And also in Chinese restaurants, particularly in places like Chinatown, San Francisco, but local Chinese restaurants, just anecdotally I've heard, have been slower, and restaurants across the board, but people are worried about Chinese restaurants in particular. It's totally unfounded.
This has also happened in the Human Relations Commission at their last, in their February meeting. They talked about examples where, anecdotally they had seen or they've been told by people that they were experiencing this type of prejudice, or they'd see an Asian person, and then all of a sudden all the people that were walking near them would suddenly move to the other side of the quad. Kind of over the top reactions that were starting to come out, and so that's one of the things that they're going to look at trying to address.
Yeah. You just mentioned restaurants. Maybe we can touch upon that for a minute. Are restaurants changing what they're doing at all to reassure people that it's okay to eat there, or are they seeing more takeout? Or
I spoke with a bunch of restaurant owners this week. Most of them are seeing slow business, particularly from cancellation of large group events, either like less travel from out of town, business things, or tech companies who usually book large events or lunches. Luckily they all said, we are already under pretty stringent health, where we take a lot of precautions just to comply with the health department's requirements as restaurants. But almost all of them said, we're purchasing additional hand sanitizer for staff, talking a lot about cleaning, not touching your face often, washing your hands often, all the same precautions that we're hearing about, they're reinforcing with their staff. And they are saying, it's safe to eat out, and that they are going to hurt long term if people choose not to go out to restaurants at this time.
Yeah. I mean, the number of cases that are unrelated to those patients who had coronavirus is still very, very small for an entire county.
This is one of the things that when you look at other countries, for example, of course, China, they got hit with it first. So, it just, ballooned, let's say, almost out of control. But then you look at places like Italy that should have been prepared, and then they've had some gaffes. I think someone was accidentally released from a hospital or something, and there was something that slipped through the cracks, and then they had a lot of cases. So it didn't just go, it hasn't gone from, let's say, 2 cases to suddenly 50 or 60 overnight.
Right.
Or we haven't seen that kind of ramp up here.
Right.
Doesn't mean it won't happen, but it does indicate that the message is getting out and people are mindful to some extent, and also just the containment aspects of it. I think they have done a pretty good job of trying to control that. And test people, keep them quarantined for 14 days. There's a reason for that.
And it seems like every time there is a case, Public Health Department makes it well known that they're trying to find anyone who had close contact. It's not just you walked by in the hallway, but close contact with that person for the prior 48 hours.
Exactly.
Are there other containment strategies that hospitals, we haven't mentioned the VA yet,
Yeah.
public health are using right now to just make sure that this virus isn't spreading?
Well, I think the VA is a really good example of a place that has been really transparent about exactly what it's going to do and is doing. Let's step back for a second, just say that all of the hospitals and medical facilities, whether it's Palo Alto Medical Foundation, I'm going to have a story about this a little bit later, what they're actually doing. They're following CDC recommendations. And so when I call and say, well, what are you actually doing? It's sort of like, I wasn't getting very much traction on the story, the info.
Yeah.
And at first I felt frustrated by that. But one person sent me over to the CDC, here on the CDC site, what they're recommending for hospitals. And when you see it, it's really pretty extensive. They have it every step of the way, what you're supposed to do, what you're supposed to look for, how you're supposed to clean, what you're supposed to do for your workers. Everything is covered. So it made me feel a little bit better that there is really a protocol that's out there that's available. Now, as for the VA, what they did when they had somebody come in, the person was sick, but they didn't want to go to a regular hospital. They wanted to go to a VA hospital here in Palo Alto. And they have actually set aside an entire area that is just dedicated to isolation and just dedicated to the coronavirus cases. So you're going to have, they're really isolating them. They're really controlling the environment. And I think that it really shows a real effort not to mix things up, really keep people separate. There's a student program that they had, a work program, and that has been suspended. And just to make sure that, abundance of caution that the kids don't get it.
Yeah, the kids weren't even going to be in that area, but not to bring them on campus at all.
Just in case, you're making sure that isn't going to happen. So,
Do we know anything about what Stanford's doing? And Stanford just announced yesterday that they have a few people being treated. We don't know how many.
Right. Well, Stanford has, the new hospital, both hospitals actually have isolation rooms. And I don't think they gave me a number. They didn't have a number off the top of their heads about how many there are, because they said, I don't think they wanted to commit to that because there's a flexibility aspect of this. So, in other words, if you started out with 50 isolation rooms, you could ramp up to many more. And they have the capability of doing that. They do have, when you go into the ER, first of all, every single organization, whether it's clinics or hospitals, are saying, don't just rush in, call first, so that at least somebody can meet you at the door with a mask. And if you do present with these types of symptoms that we talked about, the fever, the cough, and the shortness of breath, at Stanford Hospital, and I'm sure the others as well, you will not even go into the main entrance for the emergency room. You will go into there's a separate entrance that puts you into an isolation room. And what these so-called, I forget what, I think it's the negative air pressure room or something.
Air goes in.
Yeah, the air comes in, but it doesn't, it circulates within the room and it doesn't go out anywhere else. It doesn't go into the rest of the building. And so they have a very tightly controlled situation for patients who come in. And that's mainly, then there's all of the masks and everything else, the gloves, the suits, whatever it is that employees and doctors are going to be wearing. But they do really seem to have a pretty well-organized way of dealing with it. Stanford also told me that if they run out of rooms for isolation, they could go back to the tents like they used to. I think there's another hospital, I think it's Summit, maybe, don't quote me on that, but one of the other hospitals actually has set up like tents or outside facilities so that people are separated from the general population.
Interesting. Well, there's certainly a lot of protocols in place, a lot of efforts going into containment and proper handling of people who appear to be sick. It seems to me that the baseline message from public health is don't panic, don't go to Costco and grab all the supplies you can so you can hunker down in your house, because that's likely not happening. That's definitely what they're trying to avoid is massive spread of the virus. And
I think the other thing too, when you see the photographs like of people at Costco actually climbing the shelves to try to get to the supplies, and people are all like grabbing, they're all, it's just crazy. And somebody said to me, what about the fact that you're all packed together doing this. Just spreading the virus isn't kind of defeating the purpose.
Yeah.
Because you're just on top of each other, breathing on each other while you're doing this. So yeah, and it just kind of, it's just a feedback loop, where if you know that there's panic out there, are you going to go out and say,
Right.
even though you
Should I
weren't
stock
panicking,
up?
say, you know what, better stock up because I'm not going to be able to get these supplies later.
Yeah.
So it's just a never
Yeah, anxiety is
cycle.
understandable,
Yeah.
but there needs to be some understanding also of precautions that are being taken by public health and healthcare workers at hospitals to stem the spread. So, thank you both. It's been an enlightening conversation, and I know you'll be tracking the coronavirus as the news continues. That wraps up this edition of Behind the Headlines. If you think there are other people who want to know the latest on the coronavirus, you can share this video with them by copying the link above on email or social media. And to stay up to date on all of the Palo Alto news, just go to paloaltoonline.com. We'll see you next week.